Hi, thank you for tuning in to Bound for Destiny. It has been a while since I've uploaded a video. Most of my videos before on my channel have to do with traveling around Colorado in my Jayco RV camper. This past year, I have not been able to upload that many videos over the last 9 or 10 months due to a medical condition, a parotid gland Warthin's tumor. "2022 Memorial Day weekend, so almost 3 years ago, I noticed a small lump one day when I was shaving, and it was really soft, and I didn't know what it was. And so I went to the VA. I'm a veteran, and I saw my primary care doctor, Dr. Spence, at the VA in Colorado Springs, and he laughed at my appointment and said, "You have nothing to worry about. It's just a swollen lymph node." I tend to think sometimes we as patients, we know our bodies better than the physician, and this was one of those times for me. A lot of times I've been wrong when I've questioned doctors in the last 22 years of treatment with the VA, but this time was different. I don't know how I knew, but I knew that as a veteran and with the VA, as complicated as it is to get care, that I was going to have to start advocating for my medical treatment. It's very frustrating as a veteran or a combat veteran who's 100% permanently, totally disabled to have to scratch, gnaw, fight, scream, whatever you want to say, to try to get medical care approved through the VA. It's very frustrating. The number one thing that jumps out to me is that me at the age of 47 years old, I'm a youngin' compared to a lot of older veterans that are in our country that wear the red, white, and blue on their heart. And if the VA is going to be so complacent with my medical care, I can only imagine the complacency with older, elderly veterans that need a lot more special care and treatment than I would consider for myself. So it's frustrating. If you're not a veteran, I'm just telling you, it's a very, very frustrating experience to work with the Veterans Affairs Administration. Very frustrating. But moving right along, I noticed the lump. I would say when I first noticed the lump back in 2022, it felt like the size of a golf ball. Maybe it's smaller than that. And over the summer of 2022, I continued to go to urgent cares, continued to advocate for my treatment from the VA. And finally, as it was growing, the VA was like, "Oh, maybe we should get some imaging done." So in the winter of 2022/2023, my primary care doctor ordered some CT scans and some MRI scans at the VA. And he also outsourced me in Colorado Springs to a local imaging facility. They did all the imaging back in the winter of 2022. And after they did the imaging, they understood that there was a tumor or an unidentified mass. They called it at that time a bilobed tumor. So they sent me in April of 2023, almost 2 years ago. They sent me to UC Health here in Colorado Springs to get a biopsy on the tumor to see if it was benign or malignant. Once again, having a lump almost a year later, not knowing whether it was benign or malignant, yeah, that was a lot of stress. And if you're not familiar on how they do a biopsy on a tumor on your neck, I can't speak of other areas of the body, but I do know how they did it on mine, is they had an ultrasound. I was awake. I was laying down on a table. They were rubbing the ultrasound. They numbed this area, and they had 6 different needles. And the lady told me, she goes, "We're going to stab the tumor. 50 times with each needle. So over 300 pokes in my neck as I'm laying, well, I was facing this way, and the monitor was over here, the ultrasound monitor, and I was watching them poke the tumor over 300 times with those 6 needles, and they were going to send those out for testing to see if it was going to be malignant or if it was cancerous, if it was benign. And that again was very stressful. It was stressful. And I remember I got a message through the UC Health app on my phone. Had a lot of medical words in it. I got a message from my doctor, and I did see benign on there. I saw Warthin's tumor on there. So obviously I'm calling the doctor's office saying, what's a Warthin's tumor? Looking on YouTube. And the doctor got on the phone and told me, he said, it's benign. So praise God. I'm very thankful. I am a Christian, and I am very thankful to God that this is not a cancerous growth. So that was April of 2023. And I went to go see my doctor about a week or two later after the biopsy results. And he looked at it again. He felt it. He goes, it's soft. It was not this large, obviously. It was about half this size, maybe, or maybe even smaller back in 2023. And I'll never forget, the doctor was like, we don't need to do anything with it. It doesn't hurt you. He goes, we don't need to discuss taking it out until it starts getting hard or if it bothers you. Didn't bother me at all from 2023, the biopsy, all the way up until 2 weeks ago. This year, my New Year's resolution was to take care of my physical health. My teeth, the VA, it took them 5 years to get to my teeth at 100% disability. Been trying to get these root canals and crowns. So I finally got it approved by the VA this year, and I was like, all right, I'm going to tackle my teeth, all the root canals, all the crowns I need for my teeth, take care of the tumor, and really work on my physical health, even getting back in shape, after this surgery. And 2 weeks ago, I woke up one day and this tumor, which I named Tommy Tumor, Tommy was screaming hard as a rock, felt inflamed for the first time 2 weeks ago. I actually felt like there was an intruder in my neck. And obviously that affected my quality of life. And I went to the emergency room, and the emergency room contacted my surgeon. She came down, looked at it. And what they had determined is the fact that on my lower teeth, all the root canals and the crowns that I got, that it had inflamed, and I had an infection on this lower left side of my teeth. And it literally caused, because right here is the tumor. I can feel the tumor right here. The tumor had, excuse me, I said it wrong. The root canal procedure and the inflammation and the infection caused the tumor to be infected. So I saw my surgeon 2 weeks ago at the ER. She gave me some stronger antibiotics than what the dentist had given me for the inflammation. So for the last month, I've been on antibiotics and a steroid pack. And the steroid pack and the antibiotics, for the first week and a half, it really helped. My surgery was originally scheduled for next Friday, a week and a half from now. It's Tuesday evening when I'm recording this, March 4th, 2025. Tomorrow is my surgery. They moved it from March 14th back to March 5th because over the weekend it started getting hard again, inflamed, and is very painful to the touch. To give you an outline of the tumor, all the way behind my earlobe, I'm running a line along so it feels like I have half a tennis ball or a racquetball in my neck. And they've had me on some good pain meds for the last couple of weeks. And I'm just excited about it. Tonight is the night before surgery. Tommy is going to be evicted tomorrow, and he does owe rent. definitely owes a lot of rent. But I want to say, um, as a Christian, um, I'm not really scared about this surgery. It's 2025. Technology has come so far. First of all, I trust in God first and foremost, but I also trust the surgeon, and I also trust the process. And I've seen a lot of videos. I've watched some videos on YouTube of people with parotid tumors or Warthin's tumors, and my confidence is pretty high. The night before, they did give me some anxiety medicine for 2 weeks during this procedure, just I guess to keep my quality of life. I do suffer from combat stress, PTSD, and overall, I would say that I have not had too many unwanted thoughts about this tumor. I'm just trusting the process. This is one of those things that when you're a patient, there is a fear of the unknown, but in all of the advocating, fighting for my medical health, I've learned so much about this tumor that I just want to share it with everybody. I want to share. There may be somebody watching this video 5 years from now who's really struggling to understand the whole process of a parotid salivary gland tumor. And, I would suggest that if you do notice it, go in immediately. I saw a case on the internet, could be my case as well, is that when they had the Warthin's tumor, the biopsy done, it was benign, but the individual waited 7 years to get it taken out. And that individual had some bad news when they took out what they thought was the benign tumor. It had been left unattended so long that it actually turned into malignant cancer and actually had moved from here down into one lung of that individual. So I saw the doctor said it was a very rare form of tumor. I don't think it was a Warthin's tumor, but that thought is in the back of my mind. And obviously, anesthesiology. I watched a couple of videos tonight on YouTube, and I turned both of them off about halfway through because I just found out this is my first surgery, but I just found out that while you're having surgery, the process of anesthesiology is they're putting a breathing tube down into your lungs through your throat, and it's actually a machine that's breathing for you. It's almost like you're almost in a coma, from what I understand. And this is to ensure that during the surgery operation, your body doesn't move, you're out of it. But they're monitoring you the whole time. But I probably shouldn't have watched those videos tonight, but I turned them off. And I think the biggest thing that I keep telling myself is just trust the process. And it's about 1 a.m. right now. It is the night before. Well, my surgery is at 2 p.m. tomorrow. I go in for pre-surgery at noon. And I will not lie to any of you. I am super excited about having this surgery. I am super excited about evicting Tommy Tumor. But there are some anxious and anticipation feelings. More, I would say, from my perspective, in my own personal situation, more thoughts about recovery, how much pain I'm going to be in, am I going to be able to eat normal foods in a couple days? How many days am I going to be eating Jello or pudding? I don't know those answers, but I will take them as they come, one at a time. And tomorrow, I'm going to try to get some video footage of maybe when I'm in pre-op, maybe when I wake up tomorrow evening, if I'm able to record anything tomorrow night, if I'm coherent at all. But I just wanted to make this video. If you have any type of lump, any type of situation, if you're a veteran, if you're not a veteran, please, please do not be scared to advocate for your medical health and your quality of life. This type of thing, I can't imagine, I'm a guy, but I can't imagine a lady suffering from a large, tumor, facial tumor. I can't imagine the complex that it might bring. Another thing I want to bring up that the surgeon mentioned is that with this surgery, there are some possibilities for some complications after the surgery. If they hit a facial nerve, it could cause some paralysis in the left side of my face. They also said there's something that is caused. I can't remember the name of it. If I remember it in one of my future videos, I'll bring it up. But it's a problem that they've had with some people with this surgery, to where in the future, when I eat food in this area of my face, it'll start sweating. That's one of the complications. There could be some facial paralysis from that. So once again, I've got to trust the process. I've got to trust the surgeon and realize that I'm not in control of this. So I hope this has given you a good idea of what to expect with a parotid gland, or a facial or a neck tumor. I think it's different for every single person. And the fact that I have tinnitus in my left ear, I've got a lot of sinus problems. I do believe that is complicating the swelling of the tumor, the infection, all those things combined over here. There's a lot of pressure. And when I press it right now, it's hard as a rock. So, but that is 3 years it started messing with me. Obviously, inflammation from the root canal. But you can win this thing. I believe in you. That's all I got for today.